Top of the hour here at HLN. So good to see you. I'm Lynn Berry, in today from Mike Galanos. And we do begin this hour with just a heartbreaking story along with heart-stopping video and the chilling details after this minivan that you see here was being driven into the pounding surf. This was in Orlando, Florida, and the driver was a mother. She was pregnant along with her 3 young children that were inside this car. This really now sounds like it wasn't a wrong turn. One of the first men to reach this submerged minivan said one of the kids trapped inside was actually screaming that their mother was trying to kill them. Tori Dunnan has more on this dramatic rescue. Take a look.
A terrifying scene. Watch as this minivan is surrounded by water. A pregnant woman and her 3 young children are trapped inside as the situation grows more and more dangerous. One of the men who went into the water to rescue the family spoke to CNN affiliate West 2 News.
She had this look on her face. I can't describe it. It's just an awful, blank look, like spaced out look. And a kid on her lap fighting her for the steering wheel. And the 2 in the back seat was crying with their arms out saying, "Our mommy's trying to kill us, please help."
A witness claimed the mother left the vehicle as waves began to crash into the car.
I saw her bail right out the window, and the kids were still in the car.
I saw a little kid in the back, waving his arms around, screaming, "Help, help us."
One rescuer seen here carrying 2 of the children out of the water as another jumps out of the nearly submerged vehicle with the 3rd child.
Watching them carry the kids out of the van was very emotional. Waves were just pounding into the water and down until it submerged.
The rough water quickly overtook the van after, according to some witnesses, the mother allegedly drove it into the ocean.
It started to go down pretty quick. I mean, she went straight into the water.
Investigators are looking into how this happened, telling WFTV that the South Carolina mother was incoherent when rescued and would not speak to them about the incident. Tori Dunnan, CNN, Atlanta.
All of this just so hard to imagine that a mother is even capable of this. Still just allegations. We are told the children are okay and they're with the Florida Department of Children and Families. The mother is being held now for mental observation. But when we were all talking about this, the story really reminded us, and we thought back to that infamous and tragic Susan Smith case. Remember, this was back in 1994, and Smith told police that she was carjacked and an African-American suspect took off with her 2 sons inside. Well, just days later, she eventually confessed to driving her 3-year-old son, Michael, and 14-month-old son, Alex, strapped in their car seats right into a lake, drowning them. Now, Smith was convicted on 2 counts of first-degree murder and sentenced to life in prison. But just how is a mother capable of something like this? I want to bring in psychologist Dr. Erik Fisher for some perspective on this. Dr. E, as you like to be called, good to see you. Thanks for being with me. You know, this is really not the first time we have seen a mother do something like this to their child, and anyone that's a parent would just have a hard time connecting to how is this possible. Can you shine some light on that psychologically?
Well, there is very little we know. You know, when I look at somebody who comes out of this situation with kind of a blank look in their face, one thing that's coming across my mind is this potentially a medical issue? Could she have diabetes? She was pregnant at the time, so there could be something going on with some type of hormonal issue or chemical issue having to do with the pregnancy? Or are we looking at more of a longer-term mental health issue that we don't know about? There could even be relationship issues that if she wasn't in a relationship, or there was a relationship on the rocks and she has this child that she's bringing into the world with her other children. There's so many factors that we can look at here that could contribute to this. And I think that's where we really have to just sit back and wait and collect all the facts before we make any judgments or decisions on this.
You make a great point, but I do want to get your take on the idea of postpartum depression. She had 3 kids already. She was pregnant with her 4th. The youngest was a 3-year-old. Is postpartum still a possibility 3 years after a child is born?
Is it possible if it's untreated? It could be, but very highly unlikely. Mm-hmm. I think that's why I'm saying we're looking at potentially more longer-term mental health issue if there is a mental health influence to this. Then again, also when you have somebody who is currently pregnant, you have a whole nother set of hormonal issues that are influencing the situation. But that's highly unlikely that I would say that this is a postpartum issue.
We see so often mental illness play a role in so many of the stories that we talk about. What can you do if you see, or what signs should you be looking for in family members for mental illness? And then what do you do about it if you see those signs?
Well, too often we don't speak up. We see things that we know that we talk to our spouse about or other family members about, but we feel afraid sometimes to talk to this person because we don't want to hurt their feelings. We don't know how to react. But if we see signs of something that begins to concern us, it is very important to make sure that we try to address those. Know that there might be some hard feelings at the moment, but often after that person's able to work those issues through, should they work them through, they're often appreciative of those people who had the courage and strength to talk to them. So don't be quiet, but also I just had family call me this last week saying, we have a family member who's having a tough time. How do we approach that? And, and as a professional, I was able to give them instruction on how they might go ahead to approach this individual, to make sure they have the support services in place when they approach them. Because when somebody's having a serious issue, you don't know what the response will be. And is there a risk that they might do something impulsive? Should you approach them and let them know you have concerns?
And it's being proactive and getting out there and getting the help that you may need. You don't even have to spend the money on a psychologist. There's so many free programs out there. So to take that action. Dr. E, thanks so much for your perspective on this. Good to see you.
Good to see you too. Thank you.
Thank you. Okay.